Dr. Katy Kamkar is a clinical psychologist with CAMH, and she joins me now because the princes are talking about Prince Harry yesterday, Prince William today, with Lady Gaga talking about mental health, which I guess you'll agree it's important for famous people to talk about the fact that there are mental health issues and that they should be addressed.
Absolutely. As we said, we need to make 2017 priority for mental health. As we all know, without our physical health, there is no health. Without also our mental health, there is no health. So whenever we have high profiles discussing mental health, we are able to normalize the talks around mental health. We are able to further reduce the stigma attached to mental health and mental illness, and obviously encourage early help seeking, which is very much essential.
But let's talk about mental health, and I guess, you know, we don't often enough talk about the degrees or the different kinds of mental illness, because it's like saying, well, you're physically sick, and it could be everything from a stub toe to, you know, the worst diseases. I mean, both princes today and yesterday were talking about grief, depression, long-term depression, and the impact of the death of their mother and other matters. And that is an issue of mental health, but it's not, or is it? Is it as severe as, you know, severe schizophrenia?
Well, you know, when we talk about bereavement and grief, especially the loss of a parent, especially in childhood, we know that it can often lead emotional scars, and it can be chronically painful. Now, everyone experiences it differently.
Right.
It can definitely lead to isolation, to, again, as I mentioned, chronic suffering, but then also to depression and loneliness. And
I guess the real thing is, what I want to hear from you is that there are solutions.
Absolutely.
To it. I mean, there probably is hopeful in every situation, but more solutions in something as grief or depression than in others.
Absolutely. So I think what's very important is that there is always hope, and of course we do have effective treatments available.
Right.
And it's very important to seek help. Of course, quality social support from close friends and families, but then also professional help when we need it, especially when we notice symptoms such as feeling sad or depressed most of the nearly every day, feeling depressed, or not only depressed, but then also anxious, nervous, more often than not, to the point that it would interfere with our functioning. Sleep changes, appetite changes. We want to give up our responsibilities, or we're not able to gain pleasure in our daily activities. It's very important to seek help.
I have time for one last question. If someone recognizes that in a friend or a family member, how do you help that person?
It is important to listen and to show acceptance and to provide whatever support that we need. It could be something as, would you like me to accompany you with to see the doctor? Would you like us to set up an appointment with the doctor? But listening, showing acceptance and empathy are essential.
Dr. Kamkar, good advice. Thanks very much.